and I'm just going to hand it over to Scott, and he's going to tell you a little bit of the background of what happened to him with his health and the things that he tried prior to getting upper cervical care, and then we'll kind of have a back and forth here. So, Scott, why don't you tell everyone how you got involved in upper cervical work?
I was in a really bad jet ski accident when I was about 17, and I was in a coma for a couple weeks, 2 or 3 weeks after the accident. And afterwards, I slowly recovered, but I began having this chronic pain, these muscle spasms in one of my feet, and it was throwing off my equilibrium. I was off balance, walking around, chronic pain when I'm standing and walking on my foot all the time, which was just driving me crazy. So we went to a doctor back in Louisville who was like a foot specialist neurologist, and he diagnosed me with hammer toe and proceeded to...
So, Scott, let me interrupt
sorry.
here. So,
I'm getting too into detail here.
No, so didn't you said that your feet, like the muscles on the bottom of your feet, were going into spasm and you couldn't straighten your toe, isn't that right?
Correct. My toes were basically curling up like hammer toe. So they went in and they severed the ligaments in my toes. I had 2 separate surgeries where now my toes are just straight. They don't fully bend anymore. They thought that severing the ligaments would heal it, but the pain just kept moving up into my foot. So they didn't really have any other answers.
And you were how old, Scott, at this time?
I was like 18.
And so how did having that problem in your foot limit your activity?
Oh my God. It was so painful to walk around. I didn't really want to do much physically at all because I was in pain, or I was off balance trying to walk, and I'm having chronic pain in my foot. I couldn't stop it, and I couldn't control it. So it was really, really insane.
So beyond the foot problem that you were having, did you have any other symptoms?
Yeah, I was, I just come out of a severe closed head injury from this jet ski accident. Had woken from a coma, and I don't know, I was dealing with depression. My posture, it was really pretty bad. Slouched over. I was really just partying a lot, trying to, get over the pain issues, drinking, smoking, whatever. Doing whatever I could. It was pretty tough.
So this is something actually that a lot of patients that lose their health end up doing. They don't find a solution, and unfortunately, they try and self-medicate, whether that's through drinking or smoking marijuana or taking street drugs. And so you got to a doctor. They did surgery on the hammer toe, and then what happened after that?
And after they had removed the cast and all, after they did it, my toes were now straight, but then the pain went up to the next joint in my foot. So my foot is still like just spasming a lot. And then I ended up moving out to LA, and I discovered a neurologist out here and close to where you live. And he basically he prescribed me with daily doses of Klonopin and shots of Botox in my ankle and foot. Every 3 months, I had to get more shots of Botox in my ankle and foot to calm the spasms. And I had to take the daily doses of Klonopin. And that was the only thing that helped.
So when you were taking the medication, were you able to run and do all the activities, or still were not able to function?
I actually felt better, but if I didn't have that pill of Klonopin first thing in the morning, then it would bother me the whole day if it wasn't. And if I didn't take it at all that day, I would be in horrible pain sitting at my office desk.
And so emotionally, were you suffering with anxiety and depression, or that was still fun?
Yeah, I was. Yeah.
So we'll fast forward. You have had a friend that was in chiropractic college, correct, Edwin?
Yes.
And so how did you find out about upper cervical care?
So I had a buddy that I grew up with that had moved out to LA and was going to chiropractic school, and he told me about this upper cervical adjustment that is specific to your neck. And he was like, you know what, because of your head injury, and he knew the accident I had and the whiplash that I had with this jet ski accident, he was like, you should really go in and see this student that specializes in this in clinic.
So one of the things that may sound kind of crazy to you that are new to upper cervical, here is Scott talking about clonic contracture in his foot and having had 2 surgeries in his foot. and we're sitting on an Upper Cervical healthcare page where we only correct the upper cervical spine. So now we're going, and most of you have been under care, you know that the upper neck affects every part of your body. But the last place that someone like Scott that would think about going for help would be going to a chiropractor that specializes in the upper cervical spine. So, Scott, when you first heard about upper cervical, were you skeptical, or you were like all in because you didn't know what else to do?
Well, you know what's interesting about it? I had just left a job where I had my insurance, and I didn't keep the Cobra insurance. So basically, with the insurance, I was able to buy the Clonopin that I had to have on a daily basis. But without insurance, the Clonopin was more than what I was willing to spend. And luckily, I discovered the clinic where Drew was, and on Fridays, it was only $3 for an adjustment.
So he first got to upper cervical in the student clinic at the chiropractic college that we were at. So that's why it was $3. And so anyway, Scott, I want you to tell you what happened following your upper cervical adjustment.
Oh my God. So I went in there and I got an adjustment, and I went swimming in the ocean because we live down by the beach, and I love swimming in the ocean, but whenever I used to go, my foot would be spasming even in the water when I was swimming around and kicking and running in the sand in the water. But it was the first time that I swam for probably like 45 minutes, an hour, and my foot was completely still. And I was like, that's the first time that it's been still like this. I can't remember ever being so calm. And I ended up following up with Drew a couple more adjustments like in the next 2 weeks, and I was completely off the Botoxin, and I never went back for the Botox injections, and I was completely off the Clonopin after the second week of the adjustments. In my posture, I began holding myself more erect. I began feeling better. I felt like I finally had something that was like natural, that I could heal myself. I didn't have to have fucking medication. I didn't need shots in my ankle and foot to calm it down with Botoxin or whatever. I quit drinking years and years ago. It's like I don't need anything. I can, with Drew's help and with this care, it's wild. I'm getting adjustments for my neck, for my foot, but with his care, it's changed my life, and I have complete health, and I'm feeling better, and I'm repeating wonderful affirmations to just keep getting better too. And it's like, Drew's given me just an incredible life. Thank you. Thank you, Dr. Hall.
All right, Scott. So thanks for your testimony.